Hi, everyone, and welcome to Nurses Notes 101. My name is Alexa, and today we're going to be going over sinus and atrial cardiac dysrhythmias, specifically for the NCLEX. So, first one is sinus dysrhythmias. So, this is a grouping of dysrhythmias that has an abnormality of rhythm rate and/or pattern. So, all sinus dysrhythmias uh, are in normal sinus rhythm. So, they don't have an irregularity of rhythm, they have an irregularity of rate or pattern of the rhythm. So, our first one is sinus tachycardia. So, this is a normal cardiac rhythm, but the rate is high. So, our normal range for normal sinus rhythm is 60 to 100. ST or sinus tach is any rhythm over 100 beats per minute. Causes of sinus tach include anxiety, activity, pain, fever, medications, anemia, decreased cardiac output, or decreased blood pressure. With those two, your heart rate can go up if your body's trying to compensate from low cardiac output or low blood pressure. With sinus tach, we usually do not give medication for it. What we will treat is the underlying cause. So, if the patient has back pain, like in this picture, we're going to treat the pain and that should relieve the fast heart rate. Let's say the patient has a fever, we'll give Tylenol and that should relieve the fast heart rate. Sinus bradycardia. So, it's grouped in sinus arrhythmias. So, it's a regular cardiac rhythm. However, this cardiac rhythm has a rate of less than 60. So while our normal heart rate is 60 to 100, this rate is under 60, which means it's bradycardic, it's too slow. The causes of this are vagal stimulation, hypoxia, or medications. However, if someone's bradycardic and they're athletic, extremely athletic, like they're a runner, that could be a reason why they are bradycardic. So that would be a normal finding for an athlete. If the patient is symptomatic, the treatment we would give is either atropine or a pacemaker. So, what I've seen in the bouts of an emergency, let's say someone's symptomatic, their heart rate's in the 30s or the 20s, we would give atropine. However, if they are symptomatic pretty consistently, while we can give atropine and we will in the midst of an emergency, the patient will probably be undergoing a pacemaker procedure once they are eligible to. The next and last sinus dysrhythmia is sinus arrhythmia. So, sinus arrhythmia is a regular rhythm. However, it increases in heart rate during inspiration, and the patient has a decreased heart rate during expiration. The causes of this, one of the main ones that we know of, is childhood. So, a lot of times children have this disorder and it disappears with age. There usually is no treatment because the patients are almost never symptomatic from this. But if they are, the physician can look into further treatment. Something that happens with sinus arrhythmia is while the patient ages and gets a little bit older, the sinus arrhythmia has been seen to go away. Atrial dysrhythmias. Atrial dysrhythmias is abnormalities of the atrial heart conduction system, which causes premature depolarization of the heart and/or quivering of the heart. The causes of this include heart disease, a post-open heart surgery, over 60 years old, and diabetes. The most common one that we see is atrial fibrillation, or AFib. AFib is a rapid or deorganized depolarization of the atrium, which causes fibrillating or quivering of the heart. The most common complication that we see with patients in AFib is blood clots due to blood pooling in the atrium. So, most of the time, almost all of the time, unless it's contraindicated, the patient is on aspirin or an anticoagulant. In the midst of, let's say, a new AFib onset episode, they sometimes are on heparin drip as well. And to treat this, if they're an uncontrolled AFib with a high heart rate, let's say in the 130s, 140s, we can cardiovert and we can also give antiarrhythmics. A flutter or atrial flutter is caused by abnormal electrical impulses in the atrium of the heart. So, when someone's in a flutter, the depolarization of the heart occurs at 250 to 350 beats per minute. The treatment for this, if their rate is that high, is either cardioversion or an antiarrhythmic. If they're symptomatic and their rate is that high, they're probably going to cardiovert. Premature atrial complexes, or PACs. So, PACs is actually an ectopic beat. So, the underlying rhythm is normal sinus rhythm, but a PAC occurs when a electrical contraction from the atrium is discharged prematurely or early. The treatment of this is usually unnecessary. What can be done is to reduce the causative agent, either stress, avoid alcohol, and avoid caffeine. Last but not least is SVT. SVT is called supraventricular tachycardia. SVT is an abnormally fast heart rate, so the heart rate's going to be over 160 beats per minute. This originates above the ventricle as well, which is why it's called supra. Supra means above. And as depicted here, you can see the rhythm is extremely fast. This we definitely do want to treat if the patient doesn't break out of it on their own, which sometimes I've seen them do. Again, the treatment for this is cardioversion or antiarrhythmics. To go over, common antiarrhythmics that are used with atrial dysrhythmias are either amiodarone or cardizem. We could also give metoprolol IV push. I've seen people give a dose of 2.5 IV push or 5 milligrams IV push, depending on how good the blood pressure is. If the blood pressure is on the lower side, then we don't want to give a crazy dose. We can see if 2.5 milligrams will work, all depending on physician orders, of course. All right. And then along with that, the joules of cardioversion is less than the joules of defibrillating during cardiac arrest. Just be aware of that. Okay. So that's it. Thank you for listening to Nurses Notes 101. Please like and subscribe to my channel. Thank you.